Are you one of the 40% who think if you brush your teeth harder, they will get cleaner? Or are you one of the 30% who think baby teeth, they don't really need to be taken care of? Welcome to this exciting episode of the Wonder Tooth Podcast. Today we will discuss the 10 biggest myths about dental treatment. First of all, if you like this episode, do not forget to subscribe, like, and share, and tell me in the notes below if you have any comments or if you have any questions. Today, we are going to give you a code DENT55. If you have any questions or if you want a free consultation, feel free to put DENT55 and ask me in the comments below. But first of all, let me talk a little bit. Who is Dr. Saad? Who am I? I am a cosmetic dentist practicing in the state of New Jersey. And I have been doing dentistry for over 20 years now. I am licensed to practice in Canada, in the US, and in Egypt. I actually practice in all three countries for over 20 years. But I still got my looks. Thank God to creams and genetics. So today, we're going to talk about some really big misconceptions about dentistry in general. So some people, 40%, that's a big number, guys. 40%, they think, okay, if I scrub my teeth really well, they're going to get better, they're going to get cleaner. And if I get that extra beautiful, extra hard toothbrush, my teeth are going to get cleaner. Guess what? This is all wrong. If you go to your dentist, they will say, you have to use a soft or an extra soft toothbrush. It doesn't really matter about how hard you're brushing. It depends on how you're doing the movement, the technique. Okay, some people, I'm a small kind of dentist, and they will come to me and like, how on earth can you pull somebody like huge, somebody's tooth? How do you do that? It's not really about the force, it's about the technique. And I had a patient, I will never forget that. Big guy, big guy. He is a contractor, has, those huge Harley Davidson, if you know what I mean, came to me and he goes, you gonna pull my tooth? And I said, I guess. And he sat down and 2 minutes in and out. And he was like, how did you do that? Oh my God, he's a big guy. I said, well, it's all about the technique. So for your teeth, it's really not about how hard or medium your toothbrush is. It's all about the technique. And you really have to use a soft or an extra soft toothbrush. And why is that? Because if you're using, I'm talking about the bristles. If you're using a hard or a medium bristles, imagine what the damage you're doing to your tooth now. You're scrubbing your teeth. These are not tiles, guys. These are your teeth. And there is some living, like the outer surface, it's mostly 97% inorganic. I'm talking about the enamel. But underneath that, it's some organic material there, and this is where the nerve endings are. We want to stay away from that. So make sure you're brushing, gently. It's all about the technique. If you check my previous episode about overbrushing, you will see exactly how you can brush your teeth in the proper way. And it's called overbrushing your teeth, what you're doing wrong. So make sure you watch that episode because I'm actually putting like a model, and a very fancy model, actually, if you know what I mean. But 40% of people, they actually think that, which is completely wrong, guys. I'm a dentist and you gotta brush gently. Remember, these are your teeth. You wanna preserve them. You don't wanna harm them. Which actually, by the way, yesterday, I actually did that to myself. Believe it or not. I'm a dentist, yeah, but I still admit to my mistakes. I was in a hurry. I was rushing, like kids and this and that. And but I'm using a soft brush, but the head of my toothbrush, I did it so quick that I actually hurt my gum. And I know this is called a gingival abscess. Like I hurt it so hard. It's not an abscess like from the tooth, but it's the gum. Like when you overdo it and you hit your bone or your gums, they just become a little bit inflamed. So how I'm taking care of this, I'm just kind of rinsing it with warm salt water. And I know in a matter of couple days, it's going to be okay. So number one, soft brush and brush gently. Circular movement, okay? Very light circular movement. So this is number one. We're gonna brush slowly, gently, 2 minutes. So the top part here, that quadrant, 30 minutes, bottom, another 30. And so you have to brush really for 2 minutes. So this is the first one, check. Now, some people think that bleeding gums is normal. Are you one of those people? Do you really think if your gums are bleeding, then that's normal? That's not the normal, guys. Let me tell you that. Let me break it down to you. This is not the normal. This is your body is trying to tell you, I have a problem. You gotta come and fix me up. Okay? This is basically, when you get a cut and it starts to bleed, that's exactly the same thing. Your body is trying to tell you something happened, something is going on, and you gotta take care of me. So when you are brushing or you're flossing, or when you wake up and you find there is blood on your pillow, that's not a good sign. That's a very bad sign. That means something is wrong and your body is trying to tell you nicely before it starts to really hurt you, okay, I have a problem. So bleeding gums, how do we fix that? Okay, two things, very important things. There is one that's gingivitis, which is reversible, which means early stages of gum problem, you didn't brush for like a week or 2 weeks and your gums are a little bit puffy. You touch them, they start to bleed, but you didn't have bone loss yet. You cannot see that in your mouth, obviously, but when you go see the dentist and they take an x-ray, then you can, okay, there is some bone loss. So this is reversible. So gingivitis is reversible. You brush, you floss, okay, things get better. The gum, swollen gums start to get a little bit better and thins out and things get better. Gum disease, it's irreversible, and this is when there is bone loss. So your gums are bleeding, you can start to see, okay, recession, the gum is going up here, shrinking, okay, the teeth are starting to look longer. Have you seen that? Did you ever look at your mouth and you, like at yourself in the mirror and you felt, okay, my teeth are getting longer, what is that? Well, they're not getting longer, it's the gum is receding now. So this is significant, and you have to really take care of that, because gum disease can lead to a lot of systemic disease in your body. Like heart problems are linked with gum disease. Diabetes is linked with gum disease. Alzheimer is linked with gum disease. Recently, arthritis, rheumatoid arthritis, because it's an inflammatory disease. Gum disease is an inflammatory disease, so they kind of, okay, let me push you up too, come on. It's the same, inflammatory cells, they come and they kind of trigger your body, and basically they cause a lot of problems. So bleeding is not normal. Okay, guys, so this is number 2 now. Bleeding is not normal. If you're bleeding, that means something is going on. Okay, did you get that one? Please let me know in the show notes down here, and don't forget to subscribe, okay? Now, 32% of the adult population, they think, I don't need to floss. I'm brushing, I'm good. And a lot of them, they come to me is like, I brush, I floss maybe once a week or twice a week, and that's not okay. 32%, 1/3 of the population think flossing is not important. Well, let me tell you that, guys, it is very important. It's part of brushing and cleaning your teeth. So your tooth is basically like a little square. Let's put it that way. You're brushing the top, you're brushing the inside, you're brushing the outside. What about the tooth sides in between the teeth? How are you going to get there? The toothbrush will never get in there. It's impossible. Unless if you have like every other tooth, then you can. Then you don't really have to floss. But I hope you want to keep your teeth in position. And I always tell the bitch, floss the teeth that you want to keep. And they look at me, they're like, what? And I'm like, yeah, if you want to keep those teeth, you better just floss. Okay? Please, flossing is very important. What kind of floss? And this is a very important question. Use the floss that you can basically control, and the one that after you're flossing, you feel, okay, my teeth are clean. I'm not going to tell you names like use the wax, use the unwax, or use a thick floss or a thin floss. If you have spacing, then maybe double the floss. If you are they're very tight in there, maybe use the wax one, maybe use, the tape. Whatever you can, just to clean between your teeth. And then basically, when you do this, you feel like, okay, my mouth is clean. Okay? This is number 3 now. We're going to talk now about number 4. Is teeth whitening? And this is a very common question. Can teeth whitening damage your teeth? The current ones in the market, or if you go to your dental, your dentist, I don't think so. However, you have to make sure, of course, that you are getting something that's FDA approved, and don't do the DIY and don't do the whatever. Listen, I watched a couple of podcasts that are actually given by dentists, and I don't know what to say, but they are telling people that brushing doesn't really clean your teeth. Are you okay with that? And that flossing that is not going to protect your teeth. But you can use that product that I'm partnered with, or you can use that particular product if you go to my website. Okay, I am a dentist and I have an experience of over 20 years. I love what I do, and this is wrong, guys. Okay, I'm sorry to say that. This is not the magic formula. You have to do the job. You are responsible of your own mouth and of your own teeth, and you have, unfortunately, to brush and floss like there is no other if you want to keep your teeth in position. Teeth whitening, if it's done properly, and if it's basically kind of the gums are being protected, the cheeks. So we use a professional whitening than when you come in the office. So it's a whole big process. It's done over probably an hour and a half to 2 hours. You leave with really white teeth. However, there are certain criteria too. If you have like fillings, if you have like veneers, if you have porcelain crowns, if you have sensitive teeth, then this is not for you. And there are other options, but you have to make sure that you get the right whitening for you. Everyone is different, okay? And whitening does not damage your teeth. It doesn't, because this is basically, it really works on nascent oxygen that kind of infiltrate within the enamel and basically kind of boost the tooth from within, not from, Anyway, whitening does not harm your teeth, as long as it's done properly and professionally and with the right products and what's really right for you. So you gotta check with your dentist which one is your, the best line of treatment for you, because there are different options. Now, the big one is 30% of people, 30% of parents, they think that baby teeth, that's okay. It's a baby tooth, it's gonna come and don't worry about it. We don't have to brush. They don't take the kids to the dentist. So here I am, and we see dentists, we see kids we see everybody. We see kids from 2 years old to my oldest patient is 98. But I've had one who was 102. Well, not here. She was actually in Canada, but she was 102. However, they don't bring their kids until the kid is 7 or 8. And I'm like, oh my God, we have cavities. What's going on? Oh, but it's a baby tooth. No, wait, let's go back here. Of course, the kid is coming to the dentist, 7 or 8 years old, never been there, and they see a lot of stuff and people in white jackets and a million instruments, and they get so scared and they don't know what's going on, and then they start to cry, and it's not good. So what do we need to do? I tell the people, as long as your kids start to get teeth in their mouth, baby teeth, and I'm talking, I wouldn't do 6-month-old because that's a little too much. Around 2 years old. 2 years old, 24-month-old, because this is when they have pretty much the full set of their baby teeth. Take them to the dental office because they need to get used to it. They need to see the dentist. They need to see the hygienist. They need to see it's fun. This is, oh, look at the mirror. Oh my God, look at my, my tooth count. And they get a little sticker, and then we give them a little brush and let them brush their teeth. Show them the instrument. This is this is that. This is the water, the water flosser. This is that. Let them get used to going to the dental office. This is very important, and this is going to last with them for the rest of their lives, because if they don't feel scared, then they will continue to take care of their teeth. But the most important part is baby teeth, they're actually holding the space for the permanent ones that are coming underneath them. So if there is a tooth now that's completely decayed and had to be extracted, well, first of all, the kid cannot eat now properly. But second, if you don't have something called a space maintainer, which is like a little metal thing that we put to preserve that space, the permanent tooth is gonna come and there is no space. So where do I go now? Well, I need to come. So they start to come from outside, where they're towards the cheek, or from inside. And then the whole bite is completely messed up. Maybe your kid, if you started to take care of them, showed them how to brush, to come to the dentist, show them how to floss their teeth at a young age, they didn't have to go through that. They might not even need braces or, alignments at one point. So you guys have to be careful. 30%, it's a lot of people. That's a lot of people. Parents, please take your kids to the dentist. Make sure you don't have to take them to your dentist. Take them. There are pediatric dentists, for kids. And they're beautiful and fun and colorful. And take them there and make sure they are, being checked, and they know how to brush their teeth, because this is one thing that's going to last with them for the rest of their lives. Please. Okay, what else? Only sugar can cause cavities. Who agrees with me? Only sugar can cause cavities. Is that right? Do you really believe that? Okay. Okay, let's go back. What about carbs? Do you know that carbs transform into sugar and then they can go and cause cavities as well? Do you know that milk? And this is also for the parents who I'm just giving my kid a little, milk bottle at the end of the night and let them. And then the kids come to us with oh my God, their teeth are gone. Completely destroyed, completely decayed because of that bottle that they give them at night, or a little bit of juice, just a little bit of juice and some water. It's okay for them just to soothe them. Oh my God. No, this is not okay. Whatever they can drink at the end, before they go to bed, is really a little bit of water. And I wouldn't, because then it's going to get wet. Okay. I'm a mom, so I kind of know that. But please, anything that's going to touch your mouth, that's you're gonna chew or you're gonna drink, that's not water, that's gonna cause cavities if you don't brush it or floss it or rinse right after. And that includes a lot of acidic food, carbs, anything that's going to sit between your teeth, and basically the bacteria, they're gonna have a feast in your mouth. So you gotta really, really take care. Remember, we go back and say flossing and brushing, and I hope that part is clear now. Not only sugar can cause cavities, but everything that's not water. And I'm talking plain water. I don't care if it's tap water, bottled water, but water is okay. Anything else, coffee, tea, juice, anything that they have acid in them, okay? Any carbs, any protein, anything that's gonna sit in between your teeth or around your teeth, if it's something liquid, milk, the bacteria are gonna come and they're gonna start to kind of multiply and basically eat the enamel off of your teeth, and they're secreting acid and enzyme. So we got this one, we gotta check that one. Now, mouthwash. You guys are awesome because you are great clients for mouthwash companies. And I'm not affiliated with anybody, so you are the great clients for any big mouthwash company. Because some people, they think mouthwash is important, and basically it's gonna do the same exact thing as if you're brushing your teeth. And I'm talking 20%. 20% of people think if I rinse my mouth every day with the mouthwash, with this fancy big bottle, I don't have to brush because it has, all those beautiful, colorful stuff in them, and they taste good and my mouth feels... No, that's not enough. I hate to say that to you guys. No, that's not enough. You still have to brush your teeth. Yes, I'm sorry. You have to brush your teeth. 2, you're gonna floss between your teeth. 3, if you really wanna give yourself a little spa kind of feeling, then you can use the mouthwash. But the mouthwash comes after brushing and flossing. 20% of people think that. And then they come and say, why we are losing our teeth? And oh my God, I'm too young to get dentures. Well, because this is a big myth. Okay, please share this episode with all your friends and families who are doing this, okay? And 25% think, okay, my teeth, they don't hurt me. I'm not gonna go to the dentist. And then they go to the dentist only if there is a huge problem, when there is, okay, now we have to pull teeth. This is a big myth, guys. You have to go exactly like, when you go to see your medical doctor once a year, you have to go see your dentist at least twice a year, at least. A cavity can happen within 14 days. 14 days. Bacteria, they are sitting in your saliva and they're just waiting for food now. Waiting, okay? Please make sure you go and you see your dentist every 6 months at least. If you have gum disease is a different story. You have to go probably every 3 to 4 months, which means you go to your dentist 3 or 4 times a year for an extra cleaning, okay? Please. Then the big one. I don't want x-rays today. I'm scared. X-ray is gonna kill me. Are you one of those patients? Okay. Do you guys travel? Do you eat bananas? Why am I saying that? Because believe it or not, eating one banana equals 1 x-ray. Okay? This is okay, crazy now. I'm talking crazy, but this is the truth. Walking outside in the sun or sitting on the beach, to get a little nice tan, this is basically, you're getting radiation, but you're not even protected. You're getting radiation. Traveling from the East Coast to the West Coast, that equals a panoramic X-ray or even a full mouth series, like, you know, when we take 18, and that one we take it like once every 3 or 5 years. So X-rays are not really, you know, they're not that scary, especially in any dental office. They will give you that big lead apron to protect your neck, your thyroid, and it covers you, and it's very minimal. It's digital X-ray. We don't do those old ones, you know, that we put in the liquid. I've done this like, oh my God, years ago. You put them in the solution and you wait, and that's, yeah, this is harsh. So I think all the dentists now, I assume all the dentists now are using digital X-rays. So make sure you go to a dentist, you know, who are in the new modern, they're using modern dentistry at least, okay? This is minimal digital X-ray, minimal radiation, and I really mean it. And a big one is also for pregnant women, because they get very, very, very scared, which I completely understand. As I said, I have 2 kids. I get it completely. However, when you get that lead apron, we usually say we're gonna put 2, a double. So that gets on your, basically it covers your neck, and it covers your whole body all the way to your knees. So your baby is completely protected and safe, okay? And for any dental assistant or whoever is taking X-ray, as long they are like 6 feet away from that, you know, from that cone, we're good to go. Okay, so this is really for both the dental staff and for patients, specifically for pregnant women. And one more thing, really, for pregnant women, we don't like to do any unnecessary treatment in the 1st and the 3rd trimester. The middle trimester is okay, all right? First, I wouldn't even, unless you come to me and it's like excruciating pain, then I'll be like, okay, let's at least try to get you some safe medication until we get to the 2nd trimester. Same thing with the 3rd trimester, same exact thing. The only thing that you really can get in the 1st or the 3rd trimester is just a cleaning, regular cleaning. I wouldn't even numb you up, just regular cleaning, because really gum disease is also linked with preterm labor, like preterm birth. So we don't want that, obviously. And also the big one is, if you have to take some anesthetic, make sure it has no adrenaline, no epinephrine. It's plain, no vasoconstrictor, okay? A lot of terminology today, but if you need anything, ask me in the comments below, and make sure you like and subscribe, you know, don't forget that. Then the big one is sugar. Well, that's my cat, and he's looking at me right now, but the more sugar you eat, the worse it's going to be for your teeth. I said before, yes, it's not only sugar that can cause cavities, but also it's not really the amount of consumption, like how much you're consuming sugar. Like, let's say it's Halloween, we have 2 days of craziness, the kids are eating candy all day long. Believe it or not, but this is actually less like caries than if you start to take a piece of candy every single night. Does that make sense? Do you guys understand what I'm trying to say here? So one day, don't feel bad. It's Halloween. Everybody's okay. Well, I'm gonna actually have a specific episode about those kind of food that can destroy your teeth. But make sure if you eat like an hour of eating sugar and candy and chocolate and toffee and everything, of course, make sure you brush and floss really well after that. Rinse with warm salt water, whatever mouthwash you want to use, that's okay. But if you are basically, oh no, I'm not doing Halloween, I'm gonna, but every night you are eating a piece of candy, or every day you're eating a piece of candy, so the more consumption you're doing, this is bad for your teeth. Okay, you're feeding your bacteria. You are really making them very happy. So these were like the 10 big ones. That was a lot today. So first we spoke about, you know, brushing harder. No, that's a big no. You have to remember the technique. You have to brush nice and gently. Soft or extra soft toothbrush. 2, bleeding gums is normal. No, it's not. Bleeding gums are not normal. 3, you don't have to floss, which is basically 32% of the population think that's you don't need to floss. Now that you have to floss, guys. Okay? And 4, that the teeth whitening are going to damage your enamel and your teeth are gonna fall, and that's not true. As long as you're getting what the best treatment for you, tailored to you specifically, okay? Then the big one, 5, is the baby teeth. You don't need to get them taken care of. That's a big one. Please share this with any parents that you know. Then only sugar is gonna cause cavities. No, that's not true. Now we know about this one. And if you don't have symptoms, don't go to the dentist. That's a big no-no. And then the x-rays are dangerous. They're dangerous. No. Okay? And the more sugar, the worst cavities. No, that's also not true. It's basically how often you are consuming sugar. Anyway, that was a long episode. I hope you liked it. I hope it was informative. Please let me know if in the show notes if you enjoyed it, if you learned something new today. Do not forget to subscribe, like, and share. Share it with everybody that you think might actually benefit from this. And don't forget, take care of your teeth so that they will take care of you. Until then, keep smiling with Dr. Saad.